Tikaf medicine and hemorrhoids. Briefly, Tikaf anti-hemorrhoids, anti-inflammatory, and analgesic medication. A. Hemorrhoids. Hemorrhoids are dilated veins and swollen tissues in the anus and the lower rectum. Hemorrhoids create when the veins or blood vessels in and around the anus and lower rectum become swollen, irritated and got infected, and this happens when there is an extra pressure on these veins. They can be internal or / external and are commonly caused by thinning blood vessel walls, pressure and straining during bowel movements. Hemorrhoids can cause various symptoms and are the common causes of rectal bleeding. Hemorrhoids are very common in both men and women. About half of all people may have hemorrhoids by the age of 50. Hemorrhoids are common, affecting nearly 3 out of 4 people from time to time. Many women get hemorrhoids during pregnancy and childbirth. The pressure of carrying a baby in the belly puts extra stress on the blood vessels in anus region, and straining to push the baby out when giving birth also puts extra pressure on these blood vessels. Hemorrhoids tend to recur after constipation, and for this reason and the other no surgery operation is needed to handle. Hemorrhoids are now be successfully treated without surgical and traditional open operations. Due to its recurring after constipation, the medication Tikaf can effectively remove and disappear all signs and symptoms of the disease within 3 consecutive days. Hemorrhoids are of 2 types. 1. A hard one that swells the tissues and dilate veins on the outside of the anus and/or in the lower rectum. 2. An infected one that contains fluids, pus, blood and discharge with bad smelling. Some of the dilated veins are painless, as others are painful on sensitive nerves that cannot be touched by fingers. Hemorrhoids can, also, be classified into internal and external, too. Hemorrhoids can develop inside the rectum, called internal hemorrhoids, and they also can develop under the skin around the anus, called external hemorrhoids. Internal hemorrhoids. Internal hemorrhoids are swollen veins and tissues inside the rectum. They may bleed when the surface is damaged by passing stool. Straining during bowel movements and pressure can result in prolapse, leading to pain, irritation and inflammation. External hemorrhoids. External hemorrhoids are characterized by dilated veins and swollen tissues around the anus. They are visible as they occur under the skin, and the irritation can cause itching, discomfort and pain. External hemorrhoids are typically more painful due to the presence of sensitive nerves in the area. Straining during bowel movements can puncture them and cause them bleeding. Signs and symptoms of hemorrhoids include dilated veins and swollen tissues in the anus and the lower rectum, itching and irritation in the anal region, pain, inflammation, and discomfort, straining during bowel movements, rectal painless bleeding during bowel movements, infection, if not treated well, prolonged erectile dysfunction, lack of sex motivation and desire as the person ever refuses even to marry.